Hi, this is Dr. Duresti with the Cranial Release Technique, and I wanted to speak briefly about the topic of cranial release and children. I've been receiving quite a few questions via email. What about CRT in kids? What about CRT in infants? How early should someone start receiving CRT? How often? All those questions that come up. So my wife's niece just had a baby, and we're going to go see the baby probably today or tomorrow, and the baby's not quite a week old. And when I look at the baby, I'll be looking just like everyone else, just the joy of seeing the baby, but in addition to that, I'll be looking at it with my eyes from a cranial release standpoint. And of course, what I'll be looking at is the eyes. Does one eye appear to be lower than the other? Does one eye appear to be more closed than the other? The ears, are they rotated? Is one ear superior? Is one ear inferior? Distortion, cranial distortion, which I can tell you, if you start to look at people from newborns to the elderly, in my opinion, everywhere you look, you'll see this distortion, this cranial distortion. So as these cranial bones shift and move, that then is actually putting tension on the central nervous system, the brain and the spinal cord. The computer that makes you, you, and me, me. The computer that's controlling every function in the body, the systems and organs and glands, the things we're aware of, the things we're not aware of, the muscles, the joints. So if you had a choice to have a central nervous system unimpeded, open, with the ability to function optimally, of course you would prefer that to one that has tension and distortion. So unfortunately, when I look at this baby later today or tomorrow, I am probably going to see distortion. And of course, I would like to do what I do best, which is this thing called CRT, or the cranial release technique. So you certainly can apply cranial release right at delivery, or a week old, or a month old, or a year old, or 10 years old. Obviously, to me, the younger the better. So if you're a practitioner out there, if you're a cranial release practitioner, again, start explaining these concepts to your patients, to your friends, to your family, because no one else is explaining this to them. If you're a practitioner of the healing arts and you are not using cranial release and you'd like to learn more about it, please visit my website at cranialrelease.com. You can click on a button that says Online Training and take a look at what we're offering. The entire training program is now online. If you're a patient or a potential patient, you don't have to be a practitioner. Just start looking, noticing people. Look in the mirror. Look on television. Take a look at the newscasters, the people, your favorite actors from Hollywood. What you'll probably see is one of the eyes will be smaller than the other. The actual orbit, the actual bony orbit will be smaller than the other. One of the eyes will be lower than the other. The ears will probably be rotated, or one ear will be lower than the other or higher than the other, depending on how you're looking. And that just tells me, as a cranial release technique practitioner, that this person's body's ability to function is not optimized. And to me, optimization is the way to go. So, go to my YouTube channel, Cranial Release Technique. If you're not a subscriber, please subscribe. There's plenty, I think there's 93 videos now we have. And you can watch on different topics really about the same thing, which is if the cranium is distorted, which it will be because of stress, both physical stress, emotional stress, chemical stress, electromagnetic frequency stress. That's the big one. I'll probably do another video just on that soon. So because of this stress, these cranial bones shift, twist, get locked into this pattern, and now whether it's a child or a teenager or a 50-year-old or an 80-year-old, they're not even aware that it's there. They're not even aware that it's happening, and yet their body is unable to function optimally. Again, if you're not seeing a cranial release technique practitioner, simple. Visit my website, cranialrelease.com. Click on Find a Practitioner, and you can search for someone in your area. And I would recommend you experience CRT and just get a feel for what's going to happen in your body, which is a nice improvement of function. And again, sometimes you're aware of that, sometimes you're not. So the only way to try it is to get on the table and experience it. This is Dr. Duresti. Thank you so much for taking the time to watch this short video, and I hope to see you down the road.